welcome. June 9th for our second Aging in Place event. This is the in-home care for those with medical needs. I think everybody out here is pretty familiar with Zoom at this point. So we are recording this. So it'll be available later on. If you want, you can also get this live on Facebook or watch it right afterwards on Facebook. And then just real basic Zoom functions. There's the chat, there's the question and answers. You can technically use either one to ask any questions you have during the presentation, and we'll try our best to get all the questions in there. I find it easiest to put them in the questions and answers, so that way we know where we're at. But if you put them in chat, or if you're on Facebook, just go ahead and type a comment in there, a question in the comments, and Scott will be there to help us out with that. With that, just to give you a little quick update, give you a little information about the group putting this on today. This is through our Johnson County Livable Community Housing Action Team, which is composed of members of the Greater Iowa City Area Home Builders Association, the Iowa City Area Association of Realtors, and a billion volunteers, it seems like, from many local nonprofits and agencies in the area here. It's probably not that many, because that would be a record for the population here, but there are a lot of people that go into making this webinar series go. So that's showing you some stuff a little too early here. I think what I'm going to do here is introduce our next speaker, Kelly Robeson, who is a home health coordinator for Kindred at Home. I was going to say at Kindred at Home, and that really just doesn't sound good. So Kelly, I'm going to get your presentation up here. All right. Go ahead, Kelly, take it away.
All right, thanks, Jeff. Yep, so I'm Kelly. I'm a home health coordinator with Kindred at Home. And so today we're just going to kind of discuss home health and what your options are out there. So the first slide, we're actually going to discuss Home Health 101. So that's kind of the basics of what home health is. And it includes a wide range of healthcare services that can be received in the patient's home. And just so everybody knows, everybody has a different definition of what a home is. You know, you might be in an actual home. We've done hotel rooms, especially when derecho hits, different facilities, assisted livings, independent livings. There's all kinds of things. So whatever you call home, we can take care of you there, or home health can take care of you. Medicare does cover home health as long as there is a skilled need. And also that the patient needs to be homebound. And we will discuss the definition of what a homebound, what that means. Thank you. So with Medicare coverage, again, homebound. So a lot of people get that confused. And I think back in the day, it used to be really strict. But with homebound, it should take exertion. It's a taxing effort to leave the home. And sometimes it's medically, they advise you not to leave your home. Whether it's a lot of COVID, that was a big reason. It might be your ability with your breathing, anything. And then also too, that it requires assistance. Some either, human assistance, as somebody helps you get out, or do you need a walker, things like that. And just, you can leave your home. It needs to be probably shorter visits, not super frequent. You can go get your hair done, go to church, go to doctor visits, those types of things. Those are acceptable. If you are referred for home health, the agency that you get would go over all that with you. So just some of the services that are available to you that are covered by Medicare for home health is going to be skilled nursing, physical therapy, occupational therapy, speech therapy. There are medical social workers or social workers, and then home health aide. So skilled nursing, what does skilled nursing do? I just put a few things out there, but there's an entire list of services that they can provide and do provide on a regular basis. A big thing is like disease management, teaching them how to, stay safe at home, take care of yourself at home. Think about it as they do work. The nurses talk to your doctor, your primary care So they keep them updated. So think about it as if that is your physician representative coming to your home. Medication management. If you get a new medication and you need management for that, that would be what that's for. If there's labs that are required due to that medication, the nurses can do those also. CAF management, wound care, and then any like complex diseases or cases. Again, there's a whole list. So if you have any specific questions, just let us know. Physical therapy. So that's a physical therapist and the physical therapist assistant that works in that area. They can do gait, stair training, energy conservation, teach you how to move a little bit more efficiently, strength, range of motion, joint mobility, work capacity, aerobic, your balance. As we all know, as we age, we lose balance. So that's a huge aspect. We don't want falls. Pain management, and then just activities of daily living. So they can help you manage those. Occupational therapy. So the OTs, and then the certified occupational therapists, or CODAs. They work on activities of daily living. They actually can help you too with home management or modification. So let's say you need a bar put in your house, in your bathroom, things like that. They can actually assist you with that. They can help you know where the best place is to put that. Functional mobility and balance, again, they couple up with the PTs. Adaptive equipment, so they work a lot with if you have any braces or any DME, things like that, they can help you with prosthetics, new walker setup, things like that. Fine motor control, and then they also do a lot too, and there's a partnership a lot with speech therapists on cognitive work, problem solving, and safety awareness. Again, keeping you safe in your own home. So speech therapy, a lot of people automatically think of the traditional speech therapy with the speaking, reading, writing, and swallowing. They also do a lot of work with memory care and cognition and behavioral modifications. So there's a lot of work speech and OTs do, especially in memory care stuff. Okay, so medical social worker or social work. So they are, and you can request one to be assigned to your case, or maybe whoever the referring physician is might request it. But they're going to help with if there's any economic factors impacting the patient's care, or if there's social or emotional factors impacting rate of recovery. If there's any red flags, things like that, they can help out with those. They can also counsel and make recommendations for, if you need to find a facility or a long-term, whichever it is. There's also financial management. They can assist you with, again, finding the right resources. They can just kind of help manage those difficult cases, and those that need a little bit more, they're there to help. Okay, and then a home health aide. A lot of people refer to this as a bath aide. That's correct. They do assist in bathing, but they also do a lot more. Again, there are hard workers there. So their personal care services like related to your activities of daily living. Again, taking care of yourself in the home. They also can assist with self-administered medications. They support the therapy plan, and then they can perform any services that are supervised under the RN or the therapist. Okay, so some examples of when home health is appropriate. So think of somebody that's been in the hospital or had either a short stay or a long stay, or went to a skilled nursing setting or a rehab. So when they're coming home, home health is going to help with that transition, and then also stay on as long as needed. If there's any new medications, a lot of primary care doctors like to use home health when there's new medications or disease process happening. Also, if for those that require the kind of PT, OT, the rehab side following a stroke or an orthopedic surgery. And then again, just if there's any new diagnosis or a progression of it that requires some assistance with that self-management. So Kindred at Home, along with a lot of other agencies, they offer a whole variety of specialty programs. So I would suggest for you or your loved ones, if you need home health or questioning if you should have home health, reach out to whichever agency you feel comfortable, or at the end of this, the gentleman you get to meet. But they offer specialty programs. So you may need one of those. Like if you have COPD, you'd want to ask, do you have a COPD program? Or do you fall, or does your loved one fall? Then ask if they have a fall risk program. There's the orthopedic programs, there's memory care, Parkinson's. Again, there's a whole variety. Every agency has its own that they, specialize in. And I would just ask, what are your outcomes like? Do you have protocols? Things like that. Okay, so who covers home health? Medicare obviously is number one, Medicaid, private insurances. Then there's a lot too. It's pretty much every insurance. It just depends on what the agency accepts. And that's the other trick. So if you ever reach out to an agency, you'll want to make sure you let them know what your insurance is. If it's not Medicare, if you have a replacement, you'll want to make sure they know that. And then there's with Medicare, there's a 60-day cert period that covers you. If you need more after that, as long as you're still meeting the criteria, you can be recertified. And then Gary, again, at the end of this, will cover some of that. Okay, so supplies. Medical supplies are covered. If Medicare is covering this, they are included in your bundle payment. You'll definitely want to make sure that your home health agency or coordinator, or even the nurse that or PT, whoever comes sees you first, you'll want to make sure that they know if you require any medical supplies, whether it's catheter supplies, wound supplies, anything like that, because they are responsible to cover that and bring that and provide that for you. You don't need to go back to the hospital, get your supplies or things like that. So please make sure you're advising them if you have that stuff. DME is not included. That is covered under Part B, and there is a copay as far as I know.
Kelly, could you say what DME is? Is that durable medical equipment?
Yes, correct. Yep.
Thank you.
Yep. And then your home health opportunities in the area. So I've listed all of the, also with the assistance of Gretchen when she gets on here next, we went ahead and listed every agency that is covered by Medicare, and that takes Medicare in the Johnson County area. I listed, so in no particular order, I just put us first because I'm the one speaking, but Kindred at Home, Johnson County, it's Visiting Nurses Association. A lot of people just refer to it as VNA. Mercy Home Health, FizMed, Recover, Comfort Care. If you want to go to the next slide, and then In Home Care, Optime, Therapy Solutions, To the Rescue, and Unity Point. The big thing is, and the reason I put it on both slides, is to go ahead and vet the agency out yourself or have a loved one do it. You can go to medicare.gov and then go to the home health, or it's compare agencies, and you go to the home health and you can just type in the city you live in, you can type in Johnson County, and it'll actually pull up all of the ones that are certified and covered under Medicare, and it rates them. There is a 5-star rating that Medicare does, and it is a tough rating. It's a tough grading scale, but it is good. That way, how good the services are, how the outcomes look. There's even patient surveys on there. That way you can see all that under there. That's all I got. Thank you.
Hi, Kelly. We've got a couple of questions here.
Okay.
Bob is wondering if you need a referral from a doctor or if this is something that you can register for by yourself.
Yes, for it to be covered by Medicare, you will need a referral. But what I would suggest to do is, number one, if you have a close relationship with your primary care doctor, give them a call. Otherwise, you can reach out to people like myself, and the other agencies have people like me too. You can reach out and say, hey, I think I need this service, and talk to them about it. And we can actually help guide you and take care of that stuff for you.
Another question. Sorry,
go ahead,
Jeff.
Scott. No, I would say go ahead and keep doing questions real quick. It looks like Gretchen, her connection. I think she's trying to get reconnected. Good. Keep doing questions, Scott. That's all I was going to say.
I've got another question. You said that people should reach out and start asking questions to the agencies. So what are some common questions that people might overlook or not really think about that they should be asking when they're interviewing these agencies and when they're doing a little bit of research?
Sure. Number one, I would ask, are you certified? Are you covered by Medicare? Are you certified? Make sure again though that they know your insurance program, because there are some even that we are not in network with, because I've had to refer them to other agencies to help get them set up there. So definitely make sure that if you have a replacement program, or coverage, that you let them know that. I would ask, what their outcomes are like. If there's a certain disease or surgery that I've had, I would ask what's their experience with that. Do they have protocols for those things? That you could ask too, like, what's it like? Because we cover a 50-mile radius of Hiawatha, so we do cover some outlying regions. And I've had plenty of people ask, like, does it matter that I live out in the country? Is that okay? And the answer is yes, it is. So I mean, ask those things, explain your situation.
Anything else, Scott, or should we go on to Gretchen here?
I think that we're ready to move on to Gretchen.
Okay, well, Gretchen, I'm glad you're able to come back. They lost power, and obviously it caused some issues. And she's in the clinic, so she is wearing her mask. But this is Gretchen Schmuck. She's a social work specialist at the University of Iowa Hospitals and Clinics. And Gretchen, I should really have this up for you. This is Gretchen's presentation, and let me know when you need me to advance things. If I don't do it, you might need to wake me up every so often like a mouse does.
I'll try not to put you to sleep. Can you hear me okay?
It's a little soft, but we can hear you.
All right. Is this any better?
Yeah.
Okay. I'm going to turn off my video just because I am in a clinic area and we are running late. So you won't see me, but you'll see the slides. Thank you. So I want to thank you for inviting me to present today, and Kelly for that wonderful information. What I'm going to try to do is flesh it out a little bit with a case study. And I would just like to go through that. If any of you have been in the hospital, maybe some of these experiences might ring a little true. Any questions, I appreciate just having them put in the chat. So we're going to start with 82-year-old May. She is a widow who lives alone. And on the 31st of May, around 7:30 at night, she started feeling a number of symptoms, just a bad headache, which was unusual for her, kind of dizzy, and she just sort of got the wobbles, feeling stumbly. Her response to this was to go to bed, hoping to feel better in the morning. The next morning, she woke up and she fell out of bed trying to get out. Fortunately, her cell phone was within reach, and she called a friend to help. The friend noted her May's speech was very slurred. She could hardly understand her. So she called 911 and the ambulance brought May to the emergency room. So May, previous to this point, has always been a pretty healthy, active person. She's got a little high blood pressure and diabetes controlled with just a medication. Arthritis slows her down a little bit. She's a bit anxious and just maybe a tiny bit overweight. She kind of got that pandemic extra weight added on there. She does take 3 prescribed medications, hydrochlorothiazide for her blood pressure, simvastatin for cholesterol, and some metformin for her diabetes. So at the hospital, she had a full workup, and we're not going to focus on the medical piece here. She had her brain imaging and labs. The resulting workup, though, was that she was diagnosed with a left-sided ischemic stroke. She had taken a long time to come in, so there wasn't too much they could do to intervene at this point, and she was admitted to the stroke unit. With her permission, her daughter, who lived out of state, was contacted and aware of the admission. So almost from the start of admission anymore, we start thinking about how do we get people out to the right places where they want to go. I'm including May as a very important piece of this discharge planning team. You have the medical team, who we will not focus on so much during this discussion. We're going to focus a little more on the discharge focus from the nursing perspective, social work, and the rehabilitation therapies most commonly involved with stroke recovery. Next page. I want to make a little comment about this whole process. What you're going to see in terms of what is assessed by the different rehab therapies and team members is there's a fair number of overlap in what they're looking at, but also some unique approaches. What can be very challenging when one is in the hospital is that it's an evolving picture. People's medical conditions change, so there might be different goals or things assigned or specialists involved or consults made. And it can be kind of frustrating as a patient to be hearing different things from different people. There are also the challenges of trying to put everybody's goals together between what team members think is most important and what May and family might think is most important. And I do have to mention that sometimes weekends and holidays can impact this process as well. So what I want to describe is how we hope discharge planning goes after stroke. So there are generally 5 major possible places May could go, depending on how severe her stroke is. And that's what the team is going to have in their mind. Would she be appropriate for inpatient rehabilitation, where she could have 3 hours a day or more of rehab specialty therapy? A skilled nursing facility where there'd be more like 1 or 2 hours a day of rehab? Can she maybe go home with services, or home and come into the hospital or to clinics or to rehab facility for outpatient services? Or is there a chance that she's going to get back to baseline during her inpatient stay? So that's kind of out there in everybody's mind. So I'm going to start with a little bit of information about the kinds of things a social worker would look for. Certainly a brief social history, where she lives, who's involved in her life. The social worker needs to understand what's going on medically and have an idea of the functional status. How is she able to take care of herself at this point? Bathing, dressing, grooming. What about more complex things? And insurance and financial resources play a big role. You're going to look for both what is covered or the coverage somebody has, such as Medicare or supplemental insurance, or if perhaps they're eligible for VA benefits or Medicaid. Do they have a managed care Medicare plan, which might have certain parameters on the different healthcare agencies or places they can use? You want to have a good idea of the home environment and a sense of if she can go there and if there might need to be some modifications, and who is there to help. The formal supports are things such as when Kelly was just talking about the services Kindred offers, or the informal support, such as this out-of-state daughter, family, friends, other neighbors, etc. We kind of look at what the patient's goals are and the family's goals to make sure that things can be met realistically. And might there be any barriers to this? Due to financial reasons or insurance reasons, are there certain options not available? What educational deficits may have as a result of the stroke or need to learn about to take care of herself? How is her cognitive status and how is her mood? Those latter two can really impact somebody's ability to rehab. Also, we want to know who is the decision maker, perhaps, if she's not able to make decisions. And we want to know what the strengths are. How has May coped with things in the past? The other piece that can play a role is what options might there be for someone in her situation? And options may vary if you're living on a rural farm or if you're living in the heart of Des Moines in terms of services available. Then social worker makes a plan and a recommendation to the team at the end. Physical therapy, very key in stroke assessment, discharge planning. They're going to take a look at, her current condition, and that can range from being bedbound to being very fit. How did she get along before the stroke? What does she need to physically be able to do to make it through a day at home safely? What modifications might be needed? How is she functioning now? And is pain an issue? I shouldn't say the nice thing about pain, but pain is perhaps a reversible limiting factor in terms of somebody regaining function. Physical therapy looks at gait, mobility, range of motion, strength, her understanding of what things are and the value of physical therapy in her progress. And what is her rehabilitation potential? What is she likely to regain after this stroke? And maybe how motivated is she? The physical therapist will create a plan of care. including a focus of what the therapy should be in the future and maybe the number of sessions, and will recommend a setting for the discharge. Occupational therapy, very similar, focuses a little more on finer motor skills, and just like physical therapy is going to make a recommendation for a plan of care and where should May perhaps ideally go after her hospital stay. Nursing has a huge role, and of course the nurses have the most contact with patients in the hospital. They are constantly assessing and reevaluating her status, her mood, her medical needs, and communicating between providers and patients and families. They have a huge role in educating her about her health conditions, about how to improve her overall health-related behaviors, about medications, about so many things. So what I like to do next is kind of look at how therapies have taken a look at May and what they've recommended. So nursing noticed May choking on a snack when she was admitted to the stroke unit. And they said, we need a speech therapy referral. So speech therapists came in and did a bedside study and found that there were really no significant swallowing problems, but that there are some things that could help May with eating, like slowing down, avoiding certain food consistencies, and to be a little aware that with that left-sided stroke, food might get stuck on the right side of her mouth. May was very worried about losing her speech. It was slowly coming back. The speech therapist was able to offer a lot of assurance that she was expected to improve, and she was doing well. For the social work assessment, we find out that, okay, she's got Medicare A and B, a supplement and a drug plan, so that leaves a lot of flexibility for where she could go and what she might need. She's a retired teacher with a pension, Social Security income, and investments, so is able to perhaps hire other assistance if needed. Son and daughter are out of state, but they're very involved. She's got local friends, nieces and nephews, and the daughter has already been established as the power of attorney for health care. May's mood is okay, and she really didn't have any significant cognitive decline from the stroke, so these are big pluses for her rehab potential. She does own a one-story home, only has a couple steps to get in. It's in a safe neighborhood. So that tells us that she could probably if she gets a little more strength and function, and go home by car and at least get into her home. May reported quite a fear of falling, and again, a fear of not regaining her normal speech. She was anxious, as we saw at baseline. So these are certainly reasonable actions to a pretty traumatic situation. She had been independent before, never had to have any kind of services. She really wants to go home and is willing to accept anything it takes to get there. So physical therapy produces its assessment, and it says that she really needs some gait and balance training, strengthening and fall prevention exercises. They recommend some assistive devices, including a specific kind of walker and some bathroom accommodations, such as getting a shower chair and handrails in the bathroom. They felt she was safe enough to go home and recommended physical therapy 3 times a week. OT also noticed that the right-sided weakness due to the stroke created some limitations, particularly with dressing, and again, heard about May's fear of falling. OT was going to go out 2 times to visit per their assessment for a home safety assessment, to check on assistive devices and compensatory techniques to deal with the right-sided weakness. They felt that her prognosis was very good for independent living. Nursing also made recommendations for the home nurse, including if anyone has been in the hospital, it seems like it's very hard to get the medication straightened out. Medication reconciliation is a very important issue, and May was put on some new medicines as a result of her stroke, and also looking at stroke prevention in the future. So medications, education, management systems, very key part of nursing interventions. Education on her condition, how and when to seek help, such as if she has signs and symptoms of the stroke, next time, please don't go to bed. Nursing has lots of education materials and can help her with home safety, including fall prevention, of course, monitoring vitals and other things, and would be supervising the bath aid that they thought she would benefit from. So you put all of these pieces together. The formal discharge planning from rehab therapies is to go home with skilled nursing, physical therapy, occupational therapy, and a bath aid. They didn't think speech therapy was necessary at this point because she was progressing, but that will be reevaluated at her clinic return appointment. She meets that homebound criteria that Clea talked about because she's going to be needing an assistive device, and it's taking right now a considerable and taxing effort for her to leave her home. So depending on the hospital setting, social work or nursing helps arrange all these services and gets documentation completed. So those kind of documentation include signing releases for the agencies that she might want to have and selecting one that's able to meet her needs. Something called a face-to-face for Medicare, where the physician documents the need for the services and that she indeed is homebound. Orders for all the rehab therapies. The notes from the therapies, the physician discharge summary and other notes from the clinic and hospital stay, demographic and insurance information, and a supply order for the walker. She will also need discharge instructions and prescriptions, which will all be reviewed, hopefully both by the nurse and the physician, and return appointments will be made. The informal supports are also very important. The kind neighbor who was alert to May's slurred speech and got 911 out there was agreeable to come and pick her up and get the wheeled walker and get her back home. Her daughter was flying back from Denver to stay with her mother for 2 weeks. And this all happened in about 2.5 days. So that is just a little case study, hopefully explaining a little bit of how what Kelly described plays out in real life, and I'd be happy to take any questions.
It looks like you've done such a great job of explaining it, Gretchen, that there currently are no questions that are popping up for us unless Facebook is active.
We do not have any questions on Facebook. Want to, and I think that Kelly probably is the best person to answer this question, but Darcy sent in a couple of questions, and I just want to make sure that we address these. So for people who are in need of services and it doesn't initiate with a hospitalization, the care agency is the entity that would be able to connect the patient with occupational therapy or physical therapy and meal services. Is that correct, Kelly?
Okay, so correct on some of that. Okay, so
Okay.
you're saying they didn't go to the hospital, that it was like they just need the services, so we're going to get the orders from the primary care doctor.
Yeah, that's correct.
Yep. Okay. Yes, correct. They can reach out directly to the agency. Even, and again, I don't want to, I'm just speaking from personal experience with Kindred at Home. I'm sure other agencies have this too. You can actually even request services online. We have a centralized hub of nurses that will take that request, and then they will actually, get your insurance information, find out your PCP, and or primary care doctor, sorry, and then they'll pass that on to us, and then we will make the arrangements. But yes, then the agency would set up the skilled services that are coming to your home. Correct. But it is very important. I do want to make sure very clear, like a doctor is included in this.
Perfect. Thank you.
Was that it? Or is there more?
Yeah, I think I kind of lumped a couple of different questions all into that one thing, but I think that we've got all of those things addressed now. Thank you.
Well, I'm gonna.
Somebody just said, "What if you don't need skilled services?" And that's perfect. I was going to bring this up too. If depending what your needs are, there is cash pay services. And I think that's actually your next presentation. But there is cash pay services that are caregivers, and some of those caregiver agencies also have nurses available.
Yes, a little preview of what we're going to be talking about next month will be on non-medical services, and there's a lot to tackle. That's why we have a whole webinar for it. But for Medicare or for medical services, yes, there are some providers that do private pay as well. It's probably a great time to kick it over to Gary Schwartz, our SHIP counselor. He is at the senior center is where he is housed when they are open. Gary is just boy, he's incredibly knowledgeable. I'll just shut up and let him talk because he knows a lot more than I do when it comes to Medicare.
Yeah, thank you. I was just supposed to spend about 5 minutes at the end today talking briefly about what SHIP is. SHIP stands for Senior Health Insurance Information Program. So our primary focus as SHIP counselors is helping you understand the insurances that might be available for you. Obviously, all of that starts with Medicare, but it clearly doesn't end with Medicare. There are a whole variety of options out there with Medicare Advantage programs. Especially in the Johnson County area, there are several carve-outs that are available to people. What a carve-out is an employee plan that they've carved Medicare out of. And so all of those plans have different benefits and sometimes different providers. And so our primary role is to help you understand what options are out there. When you have these kinds of issues, many times your prescription drugs will change. Some of your medical needs will change. And we help you look at, are there any options that you can change to at that particular point in time? Most of you probably know, if you've worked with Medicare, they have an open enrollment period for Medicare Advantage plans and for prescription drug plans. We obviously work with those kinds of things. If you happen to be low income, there are other options available to you. And there are some options that function differently based upon what your low income is and what your situation is. One of the things that we work a lot with people on is elderly waiver services, which certainly involve home health care functions, and sometimes people don't consider those. We also work with the University of Iowa hospitals and clinics in the sense that when they have a particular individual with particular needs and they have some special insurance needs, they will often refer them to us, and we work with them and try to assist them with that, looking at what insurance options are out there. When we get someone that comes in to see one of our counselors and they're just really looking for all kinds of service help, our primary role is to refer them to one of the agencies that provides that kind of service help. And I guess the last thing I would say is we really make sure when people come to see us, usually they have specific needs, and we make sure that they understand what home health care means and that they understand the need to have a medical professional involved somewhere in that process. Because I'm not aware, and maybe Kelly can be aware of this, but I'm not aware of very many people who get home health, any kind of home health assistance through Medicare, that's somewhere in that process. There isn't a medical person that's certifying a need there. And that may not necessarily be a primary care doctor. It could be a nurse, it could be a physical therapist, but there's clearly has to be a medical piece of that process to make it work easily. So we do a lot of referrals of people for if they are needing special services to one of the other agencies.
Gary, how would somebody contact a SHIP counselor to schedule a meeting?
Yeah, right now there are two SHIP centers in Johnson County. And for those who are coming from non-Johnson County, like Lynn County, there are multiple SHIP sites in Lynn County as well. In Johnson County, there's one at the senior center, and realistically, you would just need to call 356-5220 anytime between 8 and 5, and someone will answer there, and they will set you up for an appointment if that's what you want, or if you just need to talk to somebody for a period of time, they'll make arrangements for you to do that. Senior Center is in phased reopening. We're hoping right now we deal with all of our clients just like I'm dealing with you now through Zoom or by telephone. But we're hoping that beginning sometime this summer that we'll be able to meet clients face to face again through that. There also is a SHIP center at Mercy Hospital, and you can just call Mercy Hospital and they'll refer you to the appropriate office there to set up an appointment with SHIP counselors there.
Terrific. Gary, what is the open enrollment period?
The open enrollment period for prescription drugs and for Medicare Advantage plans is October 15th to December 7th each year. Now, there are a couple of other things that people don't realize that they at times can take advantage of. An example would be between March 1st, or I'm sorry, excuse me, between January 1st and March 31st, there is a special open enrollment period for people with Medicare Advantage plans. During that time, they can make a one-time change of plans if they need. So we've had a number of cases where someone has come in and they've needed certain services, and the provider they're wanting to use is not available for their particular Medicare Advantage plan, and they do have that opportunity to change during that time. They also have the opportunity to drop a Medicare Advantage plan and go to a Medicare supplement and a prescription drug plan. Now, if they're going to a Medicare supplement, then they do need to go through medical underwriting. But many times the issues that people have when they want to make that change, they can make it through medical underwriting and it's not an issue for them. So we assist them and try to help them work through that particular thing. The other thing I would mention is that there is a one-time change period for people. So if you're on a Medicare supplement and prescription drug plan and you decide you'd like to try a Medicare Advantage plan, there is what's called a one-time 12-month option that you can try a Medicare Advantage plan and say basically hold your supplement plan in abeyance for that period of time. And if you decide you don't like the Medicare Advantage plan, you can go back to the Medicare supplement with a guaranteed issue for that Medicare supplement. And so we do have people who do move both ways, and you can move both ways once in that particular situation. So in other words, if you wanted to try one, or if you tried a Medicare, let's say you decided when you turned 65 you were going to try a Medicare Advantage plan, and then something serious happened to you and you had some real serious medical situation, and you said, oh, I don't think I like this, I'd like to try a Medicare supplement. If you did that during your first enrollment period, in other words, when you were first eligible for Medicare, then you basically retain that guaranteed issue for that initial 12-month period. So there are some other options in addition to, if you are qualified for any low income service, then you get a quarterly option to change your prescription drug plans or to change Medicare Advantage plans. Medicare Advantage plans do have specific networks of providers. And so you really need to check your networks of providers so that you make sure that your Medicare Advantage plan has that provider that you want to use in that network.
It's not complicated at all, I guess, Gary.
No, not at all.
Yeah. I'm so glad that we have SHIP counselors like you, Gary, in the area that can put this down in layman's terms of all the different options and what may work best for people, depending on their needs or just even trying to figure out upcoming needs. Yeah. Scott, any questions that we have right now?
We currently don't have any questions.
I was going to say, I see Darcy wrote another question. I can answer it unless somebody else wants to.
Go ahead and answer that. That'd be great. So it looks like, yeah, is there a possibility to enter a skilled nursing facility or inpatient rehab without a hospital stay prior to that?
Yes. Yep, you can. Because we've even had some patients that do come home or that we do see for home health. And I know other agencies too that have, because there's actually a couple new rehab hospitals, rehab centers in Coralville, Iowa City area. And there's also a lot of skilled nursing homes in that area. And yes, you can get a direct referral to one of those facilities. I will say you would be again, doctors are involved in it, and you would be evaluated by an intake coordinator for whoever represents whichever facility you're requesting. But short answer is yes, you can go into one of those as long as you're qualified.
And Gary,
I
you
say
might be
Gretchen
able,
might have more to add too.
yeah, Gretchen or Gary, if you guys have anything to add. I know one thing that's come up is it really will depend on the Medicare plan that they have as far as their eligibility to do such a thing, correct?
Yeah,
Well,
yes. Go ahead.
Oh, well, it does. Well, right now, if you're looking for skilled care, with the pandemic, there is a waiver of the 3-day hospital stay that not all facilities are honoring at this point because they're expecting it to expire soon. So if someone needs at least an hour of rehab a day, as Kelly talked about being evaluated for those purposes, there are still a few facilities in the area that will accept admission at the skilled level of care from the community for people that meet that level of care. In the inpatient rehab, again, yes, you need to be able to require and participate in a minimum of 3 hours of rehabilitation therapy a day, just to make sure that, you know, as opposed to like a respite place or some place where someone can be while someone, I see the comment was needs to be gone during a research trip. You've got to meet that medical necessity criteria as well.
Sure. Anything else to add, Gary?
The other thing I'd add, you can actually be qualified for skilled nursing care in a facility and not go directly from the hospital to that facility. So there is somebody who works with this every day, probably Gretchen or somebody, I think it's within the first 30 days after you've been in the hospital for the 3-day stay.
Yes,
And then
yeah, it's either 30 days or if someone is undergoing a treatment where there'll be an interruption before they can participate in the therapy, such as maybe they're not weight bearing for a certain amount of time, that window can also be deferred.
Right. And then also, if you have a Medicare Advantage plan, you need to ask that question because some of the Medicare Advantage plans do not require a 3-day hospital stay to be eligible for skilled nursing care. So if a person has a Medicare Advantage plan, that should be one of the things when that comes up, that really needs to be one of the things whoever's helping them checks to see what are their options, because it is different.
All right, Jeff, we've got a nuts and bolts question for you. For anybody who would like to visit some of these resources or take a little bit closer look at them, where can they access those resources from this particular forum today?
Sure. From today's particular forum, it is currently going to be available on the Johnson County Social Services Facebook page. We're also we're recording this through Zoom as well, so we're going to take this recording. Ty Coleman from City Channel 4 has just been a terrific partner over the years, and all of our presentations, all of our aging in place, I don't know, we call them forums in the past or webinars right now because they're online. He has been gracious enough to edit these down for us so that they will be available in the near future. They would be, they're in a lot of places, but Livable Communities, Livable Communities website might be the easiest place to kind of find those. Or just email me, call me, I'll get it right to you. Any other questions out there? I guess you guys have done a really great job of explaining all this. I mean, I gotta say, this is maybe one of the most complex topics that we've chosen to try and cover in a 1-hour period of time. And I think that there's, I'm sure, many variables and additional questions that people might have that are specific to their situation. And if you have those questions, if they're Medicare related questions, SHIP counselors are going to be great places to go to get those answered. More questions can come in, please ask them, but I'm going to just share some information about our next events that are coming up here. Next month, July 14th, somebody kind of did a nice segue for us. We're talking a lot about medical needs right now in home care. Next month, July 14th, from noon to 1, we're going to be focusing in on non-medical needs. And this is going to be a little bit different ball of wax. Sometimes we'll see these services both utilized at the same time. And that was kind of talked about a little bit during Kelly's presentation as well as Gretchen's. August 11th, home evaluations to identify potential hazards. September 8th, at-home exercise. October 13th, reverse mortgages ins and outs. If you want to register for any of these, you can always just get a hold of me, but the livablecommunity.org website, that's right there. On our front page up in the top right, there's a little box that you can just click on that. It'll list out all those events. You click on that and you can register for each and all of these events. Another event coming up next month, June 22nd, we have a really interesting one on bone health, what you need to know. This one's just great for everybody. This is actually through our caregiver action team, but this is one for all older adults to be aware of, and those who have loved ones that are entering into their older years. Up to 50% of women, 25% of men will develop an osteoporosis fracture in their lifetime. And I think what Lori Fitton from the University of Iowa Hospitals and Clinics is going to be talking about, how can you prevent that fracture? What can you do to reduce your risks? And how can you improve your bones? It'll be a really great, I think it would be great to fit into with our Aging in Place series, to be quite honest. It's a nice little segue. So I just wanted to include that in there if people are interested. I will have information of how to connect on this on our Livable Community website. It isn't up on there right now. I just created a Facebook event this morning for it though, so you can find it on the Johnson County Social Services Facebook page, but I will have that up there by the end of the day on our Livable Community website, so you could register for that event. As always, any questions or assistance that anybody needs, you can feel free to give me a call. I would be more than happy to try and help you out, at least try and point you into what options exist and what's out there for you. And I think with that, it doesn't look like there's any new questions that are coming in, Scott. All right. Well, I just really want to thank Gretchen, Kelly, Gary for spending the time today, lending us your expertise on this incredibly complicated topic. I cannot say thank you guys enough for putting this together, and really, I think it's going to be very helpful for a lot of people. I know there's going to be some follow-up questions that are going to come to probably each and every one of you. If anybody's interested in these presentations, I can pass these along to you. Just go ahead and email me. I will try and get this out to all the folks that have registered as in a PDF format, so that you have the information of the slides that were presented. All right. Well, thank you all so much, and we'll look forward to seeing you next month, or hopefully I'll see a lot of you on June 22nd. Thanks so much, and we'll look forward to seeing you then.